Why don't we go ahead and get started? And Angela will hope for the best.
Yeah.
So if everyone will, go ahead and you just mute yourself so we don't have any background noise, although I can't promise that my dogs won't bark here in a second. That's just the new virtual world that we live in where things like that may happen, but if we can avoid it, that would be great. So if you could just try to mute yourself, that would be super helpful. So thank you everyone for joining us. We're so excited you're here. I'm Mary Catherine Levy. I'm the Director of Women United and Community Engagement at United Way of Greater Chattanooga. If this is your first Lunch and Learn with us, welcome. We are so glad that you're here. And I want to just start by saying thank you to our panelists and our moderator for taking time out of their busy day to join us. And also thanks to all of our Women United committee members who are here on the call as well. So today's event is hosted by Women United. And so for those of you that aren't familiar with us, Women United is an affinity group of the United Way. And our mission as a group is to convene philanthropic women to equip our community for success and provide opportunity for all. Through our voices, time, and resources, our influential female ambassadors, they work to tackle the community's most daunting problems that principally affect women, children, and families. So we work together to align resources to support United Way's work for education, health, and stability. And we offer opportunities for women across our region to engage in issues that matter to them the most through volunteer efforts, networking opportunities, and financial donations. So like I said earlier, we're so excited that you're all here with us today, and I hope that you will continue to join us as we host more virtual engagement opportunities, and eventually, again, hopefully sooner rather than later, some in-person events. So like I said, I know today's conversation is going to be really great, and we do have a lot to cover, so I want to go ahead and get started. Today's topic is COVID and early childhood, pivots in education and childcare. So we know that the world of childcare, already a challenging piece of many families' lives, has faced a number of challenges, especially in the midst of COVID-19. And so we've put together a great panel today that they're going to give us a little more insight into what those challenges are and the different types of pivots that have been made to help families across our region who do need and seek out childcare for their young children. So joining us are Sylvia Ramos, our Senior Director of Education Initiatives at the United Way of Greater Chattanooga, Angela Hayes, Deputy Administrator for the Office of Early Learning at the City of Chattanooga, and Katie Harbin, the President of the Chambliss Center for Children. And moderating for us today is Tracy Smith. Tracy is an account representative for Mutual of America, and she is actually our philanthropy chair for our Women United Executive Board. So Tracy, I'm gonna let you go ahead and take it away. Thanks again to everyone for joining us. And if you have any questions, feel free to drop them in the chat and we can address them either as we go or towards the end.
Well, hello, everyone. Thank you again for joining us. Like Mary Catherine said, I'm Tracy Smith, and I'll just give you a brief background about myself. I actually got involved with United Way when I moved to Chattanooga a little over 4 years ago, and I've kind of seeked out United Way mainly because my mom, when I was growing up, used to work for United Way in Austin. So I've always had kind of a close connection to United Ways, even way back when I was the kid who would be brought to work with mom on sick days or random other holidays that school had that she needed childcare for me and maybe didn't have it. So another reason why some of this topic to me is not only I can remember the days when my mom would struggle with that. She was a single mom. So been involved with Women United since the beginning. I know that when it first started, they were looking for some women to help kick it off, and I was asked to do that and got to join a few other outstanding women to just kind of rethink how this group might look in terms of service to our community and also learning about more of our community on maybe aspects that we didn't know before. I'm going to go through our three panelists and just let you guys do a quick intro to yourself and a little bit about your current role. Katie, I'll start with you.
Well, thank you. Hi, everybody. My name is Katie Harbin. Good to see some familiar faces and names, and also some of my staff around here. So they can answer even more detailed questions. But I am president here at the Chambliss Center for Children. We are a nonprofit that's been around in this community since 1872, serving children and families in a variety of ways. Of course, one of those is early childhood education. We also have a residential piece to our program. We have thrift stores, and we have transitional living for youth who age out of the state system at 18. So yeah, I'll stop there.
Sylvia?
Hello, everyone. Good to see you all. Sylvia Ramos. I am the Senior Director for Education Initiatives at United Way. And I work with a wonderful team. And what we do is really focus on children and academic youth, specifically looking at early childhood education as well as the K-12 system. And we look to connect children and families as well as partners to resources that will help our children achieve their greatest potential.
And Angela, will you fill us in on your role as well? Angela, you're muted. Can you unmute yourself? We can see you. Angela, I think you're unmuted now.
Can you see me now? Okay.
Yep, we're good. Can you fill us in really quick on your role?
Yes, I can. I am the Deputy Administrator for the Office of Early Learning. And in that role, I work with government, and I collaborate certainly across the early learning provider community to support a system that broadens and deepens access to high quality early learning opportunities for Chattanooga families. I also have the principal responsibility to oversee the federal Head Start and early Head Start programs, which serve low-income families in our community.
Thank you, Angela.
Sure.
Katie, I'm going to give you the first question here, and I was hoping you could fill us in on the difference between just childcare versus early childhood education, so we can kind of get a little bit more better understanding of our terminology here.
Sure, there's lots of terms. You'll hear daycare, you hear childcare, you hear early childhood education, you hear early learning. I think the terms that were used way back were typically daycare or childcare, and that's because really the focus was on just caring for children, making sure they were safe. There wasn't necessarily an educational component to that. It was, you know, it was really just a place for kids to be. Someone's watching them. It didn't really matter what they were doing. Now, many decades ago, we started seeing research showing that children, young children under the age of even 3, actually should be learning things. And in fact, 80% of brain development we now know happens by the age of 3. So that 0 to 5 window is really a great opportunity for children to be developing brain cells and synapses, and so there's more that should be and can be happening to children other than just them sitting there with somebody watching them. So the early childhood education and early learning piece has really become more and more important as we have seen more and more studies that show that children who have a high quality early learning experience do better in kindergarten. And children who enter kindergarten ready have a better chance of succeeding in school. And those who succeed in school have a better chance of getting a better job. And it just, you know, it's this domino effect that really starts in these early years. So childcare still does exist, but early childhood education and early learning is really what we want all of our children to have the opportunity to have here in our city. And so, you know, we actually have curriculum now, which that would have never even been a thing 20, 30 years ago, but we have curriculum and children are learning very important skills, gross and fine motor skills, social and emotional skills. There's really a lot more going on up there than we we knew 50 years ago. And so it's really become increasingly important for us to make sure that children have the ability to have a high quality learning experience, because we know that it's directly correlated to their success later in life.
Thank you, Katie. That I think will help our discussion today as we go through this. Sylvia, can you fill us in a little bit on the ALICE report that United Way received last year? I know that childcare in general is a big financial strain, not only on ALICE families, but all families. I think we can all relate to that. But can you speak maybe specifically to how those families are affected?
Sure. I think, for all the reasons that Katie has just shared in terms of what's happening in those first years of life, one of the things that we are focusing on is making sure that everyone, regardless of socioeconomic background, race, ability, has access to high quality early education, because as Katie mentioned, what happens when you don't have access to that is that you have a cumulative deficit, and you have an opportunity gap that just kind of snowballs as children get older. So one of the things that that we've done with the ALICE data, and just to be clear, ALICE stands for Asset Limited, Income Constrained, and Employed. We started looking at that particular population because one of the things that we realized is that, Head Start, early Head Start, as well as our state childcare certificate program, provide support to some families who are considered low income. And what we also understand is that accessibility, both in terms of location, the appropriate type of coverage for a family's employment situation, so for example, shift coverage, and then also who might have available spots, is a challenge for families. That, coupled with affordability, can also be a barrier to accessing early education and quality early education opportunities. So the ALICE families are actually the families that are really right above what people might consider low income, but still struggle to really access affordable, high quality early education. So this is something that I think we're trying to raise a lot of awareness around, because a lot of folks don't understand why is it that it's not affordable. I think one of the best documents that has really, I think, shined a light on the issue and done it really well is the report that came out about a year ago from Tennesseans for Quality Early Education. So they did a report, and actually there's a Chattanooga edition, and they talked about the fact that 99% of the parents that were interviewed in that report cited both accessibility and affordability as a challenge, and actually outlined the specific ways in which it impacted both their employment opportunities rather, as well as the economic impact. But to put this into some context, one of the things that came out from that report is this issue of affordability. So they found in the study that the cost of infant care is equivalent to 1 year of public college tuition. And for those of you that may not know what that looks like in terms of an actual dollar, we're talking about approximately $9,000 a year. And then if you add a toddler or a second child to that, you are probably talking about somewhere in the neighborhood of about $15,000 a year, which is about 20% of the median income of a married family of 4. And so I just want you to take a moment and sit with that. I think for some of you, none of this will feel like a stretch because you've gone through it yourselves. But I think, for example, we have a lot of folks who are now interested in this conversation who are employers and may not themselves have children who require childcare, but I think they have a vested interest in understanding what are the challenges so that their employees can participate and be productive parts of their organization. So when you're talking about affordability, it is incredibly important that we think about what are the ways that we are supporting children, families, as well as our early childcare providers, so that this can be affordable for families.
Thank you, Sylvia. I will say that the first time Women United was able to ask you some questions, I'll fess up to one of my kind of aha, I didn't realize this moments was when you mentioned shift work. And I didn't even put that in perspective for myself and thinking about that would be a challenge. So I will say, but then today, you mentioning those numbers, I just can't imagine for some people how that would be an insurmountable number of 9,000 or 15,000 a year. That's very high depending on what income levels we're talking about. Katie and Angela, I'm going to throw questions to you guys because I know United Way partners with both of you in different ways. And I was hoping that maybe you could speak to your organizations and how they partner with United Way around education.
Okay, I'm going to be very general at this point because I think that there may be an opportunity to share more specific information a little later on. But in our office and in our organization, we always work on the premise that we cannot do all we need to do and all we want to do without the help of others. So the partnership that the city has with United Way helps to magnify certainly our shared message surrounding the importance of supporting early learning. Our partnership also helps the city with logistics, which can sometimes just be overwhelming, of getting city funds to families to support early learning opportunities for their kids, and also moving money down the pipeline to organizations that will use those dollars to improve the system that serves children. And here again, I think there may be an opportunity to speak more specifically a little later on. So Katie.
Yes. Well, we at Chambliss Center for Children has been a funded partner with United Way for, I don't know, 100 years, however long United Way has been around. We've been around since 1872. So I think back to when it was the community chest, way back 70, 80 years ago, we were a partner of United Way. So we have always worked with United Way on our early childhood education and childcare program. I use the word childcare in that sense because we actually have school age children here too. And so before and after school, it's considered childcare. So I always use both of those terms there. But we also have some parents who are receiving some of the scholarship dollars through the early learning scholarships, which I think Sylvia or somebody's going to talk about later, so I won't tell you too much about that. But I think the biggest way that we work together is that Sylvia and Angela and I, along with about 35 other organizations, are part of a coalition called Early Matters. That is, our focus is really on the early childhood system throughout the city. So if you just think about education, that everything from kindergarten through 12th grade, there's a public education system, and then after 12th grade there are these universities, and there's, you know, public and private systems for those. But in the early childhood world, it's kind of like the wild west. There's really there's no system. There are churches doing early childcare, there's other nonprofits doing early childhood education, there's for-profits doing childcare. I mean, everybody's out there kind of doing their own thing. Not to say that they're doing a bad job. They are licensed by the Tennessee Department of Human Services, but there's really not a cohesive system in our city that can all work together for one common goal to help children and families. And that's really why Early Matters has come together. So we've got, of course, the city and United Way in that group, but then there's also a lot of other organizations and childcare providers who are trying to do what's in the best interest of children and families, whether that's creating more seats or making the seats we have more affordable, or providing support to childcare providers, or providing resources to parents. There's just a lot that we do as in partnership as a coalition.
Thank you, Katie. I know I heard you mention it a minute ago. There was the Chattanooga Early Learning Scholarship, and I was hoping that Sylvia, maybe you could start with this and fill us in on the impact of that scholarship to our community, as well as maybe some of the challenges. And I'll have Angela fill in any gaps that maybe from the city, your perspective.
Sure. I am really excited actually to talk about the scholarship. We have a great team that has been working in the United Way in partnership again with the city. The Early Learning Scholarship came about 3 years ago. And, I think we have to give credit where it's due. Mayor Burke approached United Way about creating this opportunity to, again, assist families with the affordability of quality early childcare. And so we've been in this process of building the scholarship program for the residents of the city of Chattanooga for the past 3 years. And this was done, once again, thinking about the folks who may be making just above what is required to qualify for Smart Steps or Early Head Start. And so they would not be eligible for that kind of support, but they could be eligible for the Early Learning Scholarship, right? So we are looking to support low and moderate income folks who are either employed or pursuing education to improve the economic mobility of their families. Children must be enrolled in a center that is either 2 or 3 stars, and they can be as young as 6 weeks all the way up to 5 years old. Currently, we partner with almost 30 different childcare providers throughout Hamilton County. And in the past couple of years, we've been able to provide support to almost 80 families. Again, just by providing them tuition assistance. So we pay, the United Way is able to pay through the grant from the city, 40% of the childcare monthly tuition. And again, this just reduces the cost burden, going back to affordability, for families to be able to access this. This is also really important because right now, outside of our program, there is no other tuition assistance program that could support families who work less than 30 hours. And as you can imagine, if you have a family who is really trying to secure any type of economic security, and they are able to get a job, for example, for 25 hours a week, we want to make sure that we can step in and support them as they're trying to establish some kind of economic security for their families. But a lot of the state and federal programs have some kind of requirement that would not allow those families to qualify. So we are happy that this is a type of program that does allow us to provide support to families who are in any part of the spectrum trying to achieve economic security and stability for their families.
I want to tag in and just say that I call this population the gap people. Let's say, for instance, you have a family who does qualify for state assistance, and they are progressive and in their field in terms of moving up in terms with their in their employment. They get a raise, and that raise may put them out of eligibility for to receive that assistance that they previously received. So here again, is that really, did that raise really benefit them if they're no longer able to receive a child care assistance? In this COVID time, we think that we may see even more families that will fall in this gap. Families that previously were able to support and afford high quality early learning, they may have, their jobs may have been repurposed, or they may have lost that high earning position, and now their income has diminished. So this service, this scholarship is really, really beneficial with those folks that just fall into that gap where they just don't make enough to pay for that high quality early learning space. And so because they don't make enough, and then they make too much to qualify for that assistance, they may not, without the help of the early learning scholarship, they may not have that opportunity for their children. So it is a very important service. And I do want to mention that, you know, the Federal Department of Health and Human Services defines affordable childcare as no cost more than 7 to 10% of a family's household income. And in Tennessee, it's estimated that 30% of families are cost burdened by childcare, paying more than 10% of their household income. So any opportunity, any service that can be offered to families to help fill in those gaps are just very important.
Thank you, Angela. You actually made a great point, is that you get excited because you get a raise because you worked hard and did what you were supposed to do. And then you actually, your standard of living goes down because you don't qualify for a needed benefit for you and your family to continue to do those great things and advance your family. So thank you for that point. That's key. I know I can get excited about a raise, but not if it does that to me. So we mentioned, and I'll do a little bit of a shout out real quick to Elle Scarborough. It's listed on here in the chat. If you're looking at the chat, there is the earlymatterschat.org that's there for you to click on, that talks about the Early Matters Coalition. But I will throw this question out there so we can talk a little bit about the coalition and maybe where it started and how it's evolved over time. Katie, do you want to start with your role with the Early Matters Coalition?
Sure. Early Matters Coalition actually started as one of the subgroups of the Chattanooga 2.0 efforts that, as I'm sure we've all heard of, that started, gosh, many years ago now. I can't remember when it started, but early childhood was recognized, and I'm so glad that it was really a part of that continuum up to the workforce development and economic development. Because if we're going to have an educated, qualified workforce, it actually starts all the way back in early childhood. And so I was really pleased when our city leaders really recognized that and identified early childhood as a piece of the Chattanooga 2.0 movement. So we started way back then with a handful of people, and have grown over the years. We've done a few different projects and programs. We're actually going through a strategic planning process right now as we've kind of grown and morphed to figure out how we can really more concentrate on equity and providing opportunities for all children in our city, regardless of where they live or what color their skin is. And we're also heavily focused on trying to, again, create some sort of system that can support the early childhood community and support parents and families. So yeah, that's the synopsis of how we got started and where we are. We're still meeting virtually. We still meet once a month, and there's a leadership team that also meets once a month. So there's a lot of time that's been invested in this coalition by the three of us here, but also many, many others, including some others on this call. So.
Sylvia, Angela, do either one of y'all have anything you want to add to?
Yeah, I want to talk a little bit about Seeks for Success, integrate that into this conversation. In 2018, Mayor Andy Burt announced his continued investment in Chattanooga's children by improving programs geared towards early learning. And the mayor had this lofty goal to create 1,000 high quality early learning seats by the end of 2000, but not the end of 2000, by the end of his term, which is the spring of 2021. And hence comes the Quality Matters Fund, which is, the Quality Matters Fund was developed by Early Matters in January of 2020 to help expand the capacity and increase program quality. Eligible early learning programs seeking grants to increase their quality and increase their capacity could seek a grant ranging from $20,000 to $75,000. And here again, these parameters were set in place by Early Matters to get these funds that were partially provided by the city of Chattanooga out the door so that we could grow our capacity here in Chattanooga. And we were able to provide grants in the amount of a little under 100,000, I'm going to say around 96,000 to assist two providers increase their capacity. So we were really, really excited about that. And I'm not looking at the number, but I believe, and Sylvia or Katie may be able to share, I believe that those two grants would increase capacity, increase seats, a little over 100 seats in our Chattanooga community, a little over 100 high quality early learning seats.
That's correct, Angela.
Mm-hmm.
Wow, that's great. I know when you hear about and see the wait lists at some of these places, you know, there's definitely a capacity issue. So increasing seats in general for Chattanooga, I think is a great thing that we can be putting money towards. Now here's a big question, and Sylvia, I might start with you here. We know that obviously early childhood education has been a fragile state here in Tennessee, and maybe more importantly for our conversation in Chattanooga. We all know that we've been facing extra challenges this year with COVID-19 and what it's done to our lives. What have you seen maybe prior to COVID-19 and the state of early childhood education, and then what's changed in the last few months?
Well, I'll probably lean on Katie and Angela to really talk about a more global perspective of what we were seeing before, because as you mentioned, it has been historically, especially in the state of Chattanooga, or the state of Tennessee rather, a system that we've not had enough public investments in. And so that is part of the reason why the system has been fragile. If we had more time, I'm sure either Katie or Angela would talk to you about the fact that most childcare providers are averaging a salary of under $20,000 a year. And yet what we are asking of them in terms of shaping our most precious citizens is a lot, right, for that level of compensation. But after COVID hit, I think that's probably where I think locally I am most proud of the collaborative work that we have done through Early Matters and through the partners, you know, that are on this panel today. We really did not know what was going to happen to our childcare providers. We were not certain about what kind of state and federal support would be made available in order to keep doors open, staff employed, children and staff safe. And so one of the things, again, that I'm most proud of is that Angela mentioned that we were actually able to get some public and private dollars to come up with the Quality Matters Fund, initially designed to provide the kind of support that she described in terms of increasing quality seats. However, when COVID happened, we actually made a decision that we needed to think about how we could get money out to these centers so that we would not lose the quality seats that we have and the quality providers that we have. So we actually repurposed the remaining funds. A little over $260,000 was quickly repurposed and provided as what would be called the Emergency Childcare Provider Bridge Fund. We got that out to primarily the smaller businesses. We were really focused on ensuring that those were the businesses that more than likely would not have the capacity or perhaps just for a number of reasons don't have accessibility to state or federal dollars that would be provided, for example, the PPP. And so we were able to provide support to 50 centers. And I'm incredibly grateful, Elle Scarborough, who's a part of our team that has been putting the information in the chat, along with Angela and I, were able to really process these funds to support our local childcare providers and try to do the best that we could to get them some resources as they really were struggling and striving to do what is best for staff, children, and families. So I'll leave it there and ask Angela and Katie to maybe jump in.
I'll just say that thank you, Sylvia, first of all. During this time when we were connecting with providers, doing the application doing the application process for this fund, it was very revealing as to the financial vulnerability of these organizations. They really operate from, I was gonna say month to month, but I'm gonna say week to week. And it was revealing that without help from the Emergency Bridge Fund, many of these organizations would not have been able to sustain, waiting for money to bridge until they received more substantial funds. But it was also very heartwarming when childcare providers shared their stories as to how these small grants kept them from going under and gave them some breathing room while they were able to figure things out. And one of the things that we certainly do not or did not want to see happen is while we were trying to increase capacity to lose some of these operations, to lose some of these quality seats because of this situation. So just very proud, I'm going to use that word, to work with Early Matters and Katie and Sylvia and Elle and others to support high quality early learning facilities during this time. One of the things that I can say that we truly became aware of, we already know, but I think it spoke this situation brought awareness to the entire community that childcare is certainly essential. So.
Yes, I will echo everything they said, but coming from a childcare provider perspective, our world was turned upside down when all of this happened. You can't care for children remotely. That's not one of those jobs that you can send people home to do from there. And so I think what has happened in terms of being a childcare provider has been a huge shift in how we think about what we're doing and how we care for children, and how we work to keep staff and children safe. There was just the way we operate is we typically have floaters that go around and relieve people for breaks, and things like that are now not something you really want to be doing. Young children are also very hard to, it's hard to help them understand something like social distancing. 2-year-olds want to lick you, and it's really hard to explain to them that we're in a pandemic. Please don't, slobber on me, don't throw up on me. There are some unrealistic expectations, I think, that the CDC put out about what we could actually do in childcare. I remember reading through when we were about to reopen, and the CDC was talking about making sure that the toy one child played with did not get passed to another child. And if you all have ever been in a room of children and one takes a block and puts it in their mouth, and a millisecond later the child next to them has that block in their mouth. And so, thinking through how we set up classrooms, how we operate as a large center has definitely been a shift. So I think when you look at childcare as a whole, we already were operating on very slim profit margins. In fact, anybody that wants to make money does not go into childcare. You lose money. So just here's my business tip for you today. Don't go into childcare if you want to make any money. And if you're serving a population that's low or even moderate income, you might even be losing money. For-profit childcare programs can charge $250 a week, and they can break even. But we can't charge that for our families. And I know that would be expensive for a lot of us, especially if we have multiple children. So when you think about the childcare industry as a whole, we were already struggling to support ourselves. And now we have come back to this world where we might be decreasing the number of children in the classrooms, which means we can't enroll to the capacity that we did before. That's decreased revenue. We might need additional staff for temperature checking stations, or we might need additional staff for wiping down of surfaces, or if there's a common gymnasium area where children go in. I know there are some childcare centers that have somebody that comes in after every classroom and wipes down those riding toys so that the next classroom that comes in, there's no swapping of germs. So we're looking basically at an increased demand for staff. We're looking at a decreased ability to serve children. And so I think that it's really caused a lot of concern around what the future of childcare is. And I will also say, I think there's a lot of concern on the part of parents to utilize large childcare programs. When we have no idea what this pandemic is going to hold and when it's going to be over, the fewer number of children you can expose your child to is logically better. And so we might see a shift from having large childcare centers and to see more smaller in-home providers. I know a lot of parents are doing in-home things right now with either just their children or kind of a pod of people. So I think that we are in an interesting time in childcare, and I don't think anybody knows what it's going to look like on the other side.
Thank you, Katie. A couple of words that I heard, I think, Katie, you said one of them, you said shift, and Angela and Sylvia, I think you said you were talking about the repurposing of funds. And I just have to say that I'll reiterate a word of, I've only lived here for 4 years, and to be a part of a community that not only is asking, we have to ask the childcare providers to make pivots and shifts in the way that they do the needed work, but that we also can get behind pivoting and shifting the funds behind there, funds that we had earmarked for something else, that we got together as a community and we're able to do that. I know that sometimes that's very hard when it comes to grants. You get a grant for a specific reason and you've got to use it for a specific reason. And so it's great to know that there was some flexibility there in a year that we all need to be flexible. Sylvia, let me ask you, for everyone on this call, I think we're hearing a lot of good things about the state of childcare and what's going on here, but how can we as a community get involved? How can we support early childhood education and maybe support the centers like Chambliss?
Definitely. I think that one of the most underutilized, I think, strategies to think about supporting early education and quality early childcare is the opportunity to really become more informed so that we know how to advocate. So there's a few things that I think those of us who are involved with Early Matters try to really work on. Doing something like what we're doing right now is a part of our effort to really create advocates for this work and for early childhood education. So understanding that one of the ways that we really can think about achieving equity in our community is thinking about what opportunities we make accessible for everyone from the start. And so we want to make sure that everyone understands why it's so important that we support early childhood systems, that we invest in them, so that everyone can have the same opportunities. Again, going back to what Katie was sharing about the amount of brain development that occurs in those first years, and thinking about what are the ways that we can create more affordability for families, more accessibility for families, advocating for our state to actually spend the child care dollars that they're supposed to spend in our state and not send that back. I won't go into too much of a tangent there, but I might drop something in the chat for folks to follow up on. And I think also one of the areas that I know I've developed a great appreciation for, I do think that we need to become more informed about why it's necessary that we also pay childcare providers fair wages. I think if you were doing the math as I was sharing, it is ironic to me that the cost of childcare for 2 children can be as high as $15,000 a year, but our childcare providers are only averaging just under $20,000 a year. And so we really have to, I think, take the opportunity to learn a little bit more about how is it that we need to be investing in a childcare system? How can parents learn a little bit more about what to ask? So being informed consumers of this, I think, will also help us to be stronger advocates for the system. And I'll leave a little bit of time for Katie and Angela to add to that as well.
I have nothing to add. Sylvia said it all. Educate and advocate. I mean, that's really our biggest help will be if people support policies that are favorable to children and families. They support candidates who support policies that are favorable to children and families, and they let their elected officials know that young children are important to them. And oftentimes you hear education, 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 and they're always talking about K-12. And so to always bring up in the conversation that early childhood is just as important, if not even more important, is one of the best ways that we can this an issue that is widely supported. It's a very bipartisan supported issue too, and that's one of the things is I hate politics. I hate taking sides and being political. So I think it's one of the things that we can all agree on. And it typically has bipartisan support is early childhood education. So I would just say become an advocate and a supporter of it.
And I will only add one thing, and I would say that, and this is a part of advocating, I think it's important that we share positive stories with our legislators, and that going back to educating not only our legislators and our policymakers, but educating ourselves. And there are a couple of places that provide information ongoing about early learning, the early learning spaces and information regarding early learning, and that would be Tennessee Quality Early Education. If you can check their site out, and the Tennessee Commission on Youth and Families. Or, I'm sorry, Tennessee Commission on Youth and Children. So I would just, the only thing I would add to that would be just to celebrate those positive stories and share them with our legislators and our policymakers.
So I have a couple of questions that were sent to me privately, and in the interest of time, they kind of go together. So I'm going to try to put them into one question here. A lot of child care centers in our area had to close down during the last few months. Do we know how many of those opened, how many have not reopened, and maybe for whatever reason we're thinking maybe won't reopen? And if there's any other strains that will be put on these other facilities due to that? I would assume capacity is one of them for other facilities.
So I've received some information last week from Department of Human Service Licensing, and most of the child care programs have reopened. However, they have opened with decreased attendance. Most are open with less than 50% of children returning. And if there are any business folks on the call, you know that it is difficult for any business to operate at 50% capacity. So I think probably the more important question to ask is, what is it going to look like going forward? There has been a lot of national conversation as well as local conversation in regards to child care centers opening, losing spots and spaces and child care organizations. And nationally, it's been the figure that's been put out. It's at 50. We're going to lose 50% of our organizations, our child care organizations. And that is just really scary.
I think I would add to agree with everything Angela said. I think the real issue is going to be the long-term effect of all of this. I think right now we're lucky that at the state level we're receiving some support. Some agencies like ours got PPP funds, but you know, in 6 months, when all of that has gone away and we still haven't recovered from, you know, we're not back up to 100% capacity. I think that the long-term effects of this are actually going to be are going to be much more harsh than they are right now. I think a lot of programs, like Angela said, have reopened. But, you know, thinking about losing workforce, losing spaces, we're really taking some steps back that we couldn't afford to take, that we were already working to try and move forward. And this pandemic, I think, has really caused us to take some steps back in both of those areas. And I think it's just going to be the long term is really, I think, a little more depressing than what's happening right now.
And I just want to say that, you know, in the not so distant future, our economy will definitely recover. And those childcare seats that we may lose as a result of COVID, they will weaken the infrastructure to support our economy as it begins to return. And I think, you know, one fact here again, I want to emphasize that we have uncovered during this time is that childcare is definitely essential. And because this industry is so highly regulated and the cost associated with starting a childcare business is high, you cannot just shut a childcare business down today and reopen it in 6 months with little or no investment in terms of financial investment or time investment. So it is just very important that we find ways to support our programs and keep them alive and protect those seats that we have. It's important to our economy going forward.
I think, you know, along with the economic impact, which I think is undeniable and also outlined very clearly in that TQEE report, which I put in the chat. One of the things that has got me really concerned right now is that we know that prior to COVID, Alice families and many other families who were in the gap were cobbling together care, right? Meaning that I might be able to afford maybe someone to come and watch my child at home, and then maybe, you know, auntie watches them for the other days. Again, because families had to think about what they could afford. That was before COVID, right? And the impact of that is that going back to, you know, again, at the core for me around all of this is equity, right? That I know that this is a valuable opportunity that really has a lifetime of outcomes, either positive or negative, right? One of my concerns is that right now, families are also cobbling together their own childcare. I will not say early education because I think we're in survival mode, right? And that is certainly understandable. I think we can probably all relate to that. My children are older, obviously, and there are different challenges there, but I think we're all in survival mode. The concern I have is that this is going to create a deeper equity gap in so many areas, right? In terms of brain development, in terms of educational achievement, in terms of health outcomes. And so I have a serious concern about right now focusing on those centers that are serving vulnerable populations who were vulnerable prior to this and probably even more vulnerable now. And then thinking about, again, what is going to be the impact long-term as the opportunities and the wedge is driven deeper by lack of access to resources right now. So I do think that that is something that we need to be thinking about. And from my perspective, we need to do everything that we can to support our local ecosystem so that it can serve families and children as well as possible and as safely as possible.
Well, I know we're right at 1 o'clock right now, and we just want to be conscious of everyone's time. I want to say thank you to Sylvia, Angela, and Katie, as well as I want to say thank you to Mary Catherine for getting this all coordinated and set up. We didn't get to throw it out for questions because of the timing, but please feel free to follow up with us on questions and maybe we can get you some answers, as well as Mary Catherine is going to be sending out some additional information, not only on Women United, but also on some extra information that I think Sylvia has put together or gathered for us on some more data that has to do with early childhood education. Thank you, everyone.
Thank you.
Everybody.
Thank you.
Everybody have a good day.